Today we will be talking about quinolones specifically for eye infections. And if you consider quinolones for eye infections, then ciprofloxacin and ofloxacin. These are two quinolones that are helpful for eye infections. So indications are very simple for quinolones that are eye infections, and specifically keratitis. And if we talk about specific considerations, then there is very less data available. But if we still talk about its use while pregnancy, then it's category B3. Now, what is category B3? There is another video in which I have explained different categories of pregnancy. You can consult that video to come to know about the category B3. And then if we talk about breastfeeding, then it is actually suitable if patient needs ciprofloxacin. And if we talk about a couple of adverse effects, then it includes local ocular irritation and lid margin crusting, scaling, and unpleasant taste. Unpleasant taste. That looks a little odd because we are already taking eye drops, not any oral formulation. Well, you should know that after instilling eye drops into the eye, there is a little amount of ciprofloxacin or any of the eye drop will go into your mouth as well. And this is noteworthy thing because whenever you'll find your eye drop in your mouth, it means it's going to be in systemic circulation. And if it is going into systemic circulation, it will cause systemic side effects as well. So that's why if, for example, dose of any medicine prescribed is 1 drop, then you have to use just 1 drop. If you increase it to 2 drops or 3 drops, then side effects will appear. After that, if we talk about infrequent, these are common side effects that can occur. If we talk about infrequent side effects, that includes keratitis. So it's going to treat bacterial keratitis and it's going to cause a keratitis itself. That includes photophobia, means you won't be able to bear light, and corneal infiltrates and staining. Along with this, allergic reaction will also occur infrequently. Now let's talk about corneal perforation. Let me tell you one thing, that ciprofloxacin is one of the safest medicine as far as ear infections are concerned. So it means eardrops are very much safe for eardrum. But here we are going to talk about corneal perforation under quinolones. So it means ciprofloxacin is not going to be safe enough for our eyes. So a retrospective medical record review of cases of bacterial keratitis has shown that rate of corneal perforation has been 14%, but with ofloxacin. And that was 1% with fortified antibacterials. Fortified means those antibacterials which are not in use now, but 14% of corneal perforation with ofloxacin. So a thing to be considered. And in fortified antibacterial preparations include cefazolin 5% and tobramycin 1.36%. Now you will say that it's very odd to have 1.36% tobramycin. Well, these are hospital compounded medicines. These were not available in the pharmacy or in pre-packed or already manufactured form, but it was going to be prepared in hospital preparation. So that's why you haven't seen cefazolin 5% and tobramycin 1.36%, because those preparations were actually prepared on the basis of orders the doctor for specific patients. If we talk about comparative information, okay, so 14% risk from ofloxacin doesn't mean that ciprofloxacin is safe, but it is actually safer than ofloxacin. Still, it will have a risk of causing corneal perforation. If we talk about comparative information, that includes that ofloxacin and as far as effectiveness is concerned, ciprofloxacin and ofloxacin are similar to the efficacy as that of tobramycin. But one thing, that ofloxacin has better or improved corneal penetration, and that's why risk of causing corneal perforation is also 14% with ofloxacin. So ability to penetrate cornea of ofloxacin tells us that it's going to penetrate inside our eye. If we have any deep infection inside the eye, then ofloxacin is a better option, but still carrying the risk of corneal perforation. While if we talk about cipro, then ciprofloxacin is commonly precipitates on the corneal ulcer. Precipitates on corneal ulcer that will result in white precipitates. So it's not going in, but it will stay over cornea, and there will be formation of white precipitates. But it has no effect. These precipitates has no effect with the healing of wound. So there are a couple of practice points regarding quinolones. Number one is that it is reserved for keratitis. But remember one thing, for bacterial keratitis. And after that, the second point, that it has best efficacy against gram-negative bacteria, that includes Pseudomonas. In the previous video, we have seen the aminoglycosides like tobramycin and gentamicin has also good activity against Pseudomonas. That's why those were preserved for gram-negative infections or serious infections. It also has good activity against gram-positive, but if we compare it with gram-negative activity, it's less. That include Staphylococcus and Streptococcus. After that, we have to discuss ciprofloxacin. We'll see a little bit detail of it. So, if a patient is suffering from keratitis that is caused by bacteria and conjunctivitis, of course this should be bacterial in nature, then ciprofloxacin is one of the best options. What about dosing? Well, 1 drop every 2 to 4 hours for 2 days. And if again there is improvement of the symptoms, then 1 drop 4 times a day for 5 days, just like gentamicin, famicidine, and tobramycin. Well, this is the dosage for severe bacterial conjunctivitis. What about dosing in keratitis? For keratitis, dose is a little way different. That is 1 drop every 5 minutes for first hour, and then once every hour, then 1 drop after every hour. And if there is improvement, then decrease of frequency according to the clinical response. And that's why for keratitis, ciprofloxacin should be utilized under the direct supervision of ophthalmologist. After that, we have to discuss ofloxacin. That is another quinolone. It is mainly used for severe bacterial conjunctivitis. But it can also be accepted for keratitis. So first line treatment will be ciprofloxacin and then ofloxacin. But remember, it should be bacterial in nature. What is possible dosage of ofloxacin? That will be for severe bacterial conjunctivitis. That is 1 drop every 2 to 4 hours for 2 days. And if you notice any improvement in the symptoms, then 1 drop 4 times a day for 5 days. This is the dosing for bacterial conjunctivitis. What is the dosing for keratitis that is caused by bacteria? Same like ciprofloxacin, that is 1 drop every 5 minutes for the first hour, then 1 drop for 1 hour, and if symptoms are improving, if symptoms improve, then you can reduce the frequency of dosing. So this was all about quinolones. Next we will discuss about chloramphenicol.